Hi, my name is Yuling Chen, and I am a research associate at the Johns Hopkins University School of Nursing. I was awarded for the PhRMA Foundation Value Assessment and Health Outcomes Research for Faculty Starter Grant. My research journey began during the clinical practice when I was an intern nurse at a hospital in Beijing, China. While I worked in the cardiac department, I cared for many patients diagnosed with heart disease. Many patients still do not understand why they developed heart disease or how to reduce their risk of worsening conditions. At that moment, I feel like I could not empower those patients using my current nursing skills. I pursued a PhD degree at that hospital, focusing on understanding the mechanisms of lifestyle changes for preventing and managing heart disease. Many people diagnosed with heart disease and other problems like high blood pressure, diabetes, or high blood fat are at a higher risk of heart attacks or strokes or heart disease. So improving those heart disease risk factors means you need to take in the medications regularly and making the long-term lifestyle changes like eating better, being active, or getting more sleep or healthy sleep, and not smoking. But making these changes are really hard. My PhRMA Foundation funded research will evaluate a new program, a care program for individuals with multiple heart disease risk factors. It's called PhRMA program, which is a pharmacist-led, patient-engaged, digital health-enabled, shared decision-making interventions to improve patients' adherence to medications, to reduce their heart risk, and improve their heart health. So if you are in this group, you will receive additional support from a pharmacist to counseling about your lifestyles, your medication. You will be also asked to use an app called Healthy Heart, which our team designed. And this app will help you learn more about options for lifestyle changes or medication adherence. You can learn about the benefits and the risks, and you can select from the app. And those information will help you understand how you're going to change your lifestyle and the medication and adherence to improve your heart health. One thing that I love about research is it really helped me explore questions in human health and to discover new solutions that can really improve patients' lives. I would like to see my research findings translated into better care and the practices. The fourth thing that I would tell my younger self is to take care of my well-being by balancing the work with more hobbies, and the rest and time with loved ones, so I can sustain a long, meaningful career. For myself, I also enjoy doing a lot of exercise, like doing yoga myself and playing tennis with friends and colleagues on weekends. I'm also enjoying decorating my home, doing some painting. I think those artist activities make my life more colorful and fun. I'm also a music lover and a beginner on the guitar and piano. So I think these activities help me feel refreshed after a whole week work. As a scientist or a nurse leader, I would like to develop care programs to improve patients' health and well-being through personalized and scalable methods. As an educator or faculty member, I would like to mentor early career nurses or students, inspiring them to pursue the research in human health and to develop their own research programs in the future.